Now we will begin Triage Cancer's webinar on navigating insurance and managing medical bills. My name is Madison McMahon Ward. I am one of the speakers for today's webinar. I'm the program manager for Triage Cancer and have provided several educational seminars on the financial impact of a cancer diagnosis and how to access financial assistance. Prior to Triage Cancer, I worked with a number of Chicago-based nonprofits delivering educational seminars on different public health topics and developing educational materials with community members. I received my Master's of Public Health from Loyola University back in 2019. Also joining me for today is Monica Bryant. She is a cancer rights attorney, speaker, and author. Monica is the co-founder and chief operating officer for Triage Cancer. Throughout her career, Monica has provided hundreds of educational seminars, written articles, blogs, and co-authored a book published by the American Bar Association called Cancer Rights Law: An Interdisciplinary Approach. If you'd like to read more about Monica or myself, you can do so on our website. And if you have any questions throughout the webinar today, please feel free to write them in the Q&A box. People can feel overwhelmed when trying to navigate their health insurance and manage their medical bills. And in 2013, researchers from Duke coined the term financial toxicity. And in their research, they focus on the financial burden of a cancer diagnosis and how significant that burden can be, not only in an acute way, but also the long-term impact of that financial burden. But this isn't just about someone's bank account. There is also data that shows that that financial burden is causing stress, depression, and anxiety for patients and their families. But while this is a new term, it is certainly not a new problem. Now, the challenge with financial toxicity, and one of the reasons it is hard to solve, is that there are multiple contributing factors. So we think having inadequate health insurance is the number one contributing factor. But it isn't just about having health insurance, it's also knowing how to effectively use your health insurance. The employment changes that may occur after cancer diagnosis can impact finances. And then all of the things that happen in life that normally impact finances, like relationship changes or moving or graduating, those things continue to happen and they can compound the financial impact that somebody is experiencing after a cancer diagnosis. So in order to effectively address financial toxicity, all or at least most of these issues need to be addressed. While we know that understanding how to get and use your health insurance is the primary way to avoid financial toxicity, the problem is that our healthcare system is so complicated that Americans simply do not understand how it works or how to choose a plan. In fact, only 4% of people surveyed could define the terms used in their policy. One of the reasons that finding the right health insurance can be so challenging is that you essentially have to learn a new language in order to be a truly informed consumer. And multiple studies have shown us that Americans just don't understand health insurance, and we recognize why that is. But if right now you feel like you don't understand health insurance as much as you'd like, I want to put you at ease and let you know that you are not alone. So in the United States, there's only 3 places where we get health insurance coverage. We're either getting it directly from an insurance company, or we're getting it from the government, and by that I mean Medicare, Medicaid, military veterans plans, or state and local programs. But about 50% of the people in the United States still get their health insurance coverage through their employer. Regardless of where you are getting your health insurance coverage from, these are the terms that we think are most important to understand. There is the premium, which is the cost that you pay each month just to have health insurance. Even if you never received any medical care during the year, you'd still have to pay your monthly premium. It's like having car insurance and then never getting into an accident. But then there are costs that you pay when you get care. And the first is our annual deductible, which is a fixed dollar amount that you pay out of pocket first before our insurance even kicks in and starts to pay for our medical expenses. So for example, you might have a $500 deductible, you could have a $5,000 deductible, you could even have a $0 deductible. It's going to depend on the policy that you have. And then there's something called copayment or copay for short. And it is also pay when you get certain types of. So you go to visit your doctor, you have a $10 copayment, or you go to see a specialist and you have a $30 copayment, or you go to the emergency room and you have a $200 copayment. Again, those exact amounts are going to depend on the policy that you have. And that's different from co-insurance or cost share. And those two terms are used interchangeably. And it's the difference between what the insurance company will pay for your medical expenses and what you are responsible for paying for your medical expenses. So you could have an 80-20 plan where the insurance company is going to be responsible for 80% and you are responsible for 20% of your medical expenses. Finally, an out-of-pocket maximum is probably the most important thing to understand about your policy, because in a worst case scenario, it is the most that you're going to pay out of pocket for your medical expenses during the year. And it is also a fixed dollar amount. So you could have a $1,000 out-of-pocket maximum or a $20,000 out-of-pocket maximum. Again, it's going to depend on the type of coverage that you have. And the way that you reach your out-of-pocket maximum is that you add up what you pay for your deductible, plus any co-payments that you make during the year, plus any co-insurance amounts that you make during the year. And once you have reached your out-of-pocket maximum, your insurance is going to kick in at 100% for the rest of the year. So to get a sense of how an out-of-pocket maximum actually works, let's go through this example. Dan has a policy with a $2,000 deductible. He has an 80-20 plan, and he has an out-of-pocket maximum of $8,000. He has just spent a week in the hospital, and he walks out with a $102,000 hospital bill. So assuming he's had no other medical expenses during the year, how much does Dan actually have to pay of his medical bill? So first he has to pay his $2,000 deductible, which leaves him with $100,000. But he has that 80-20 plan, so he's only going to be responsible for 20% of that $100,000 bill, or $20,000. But remember, he has that $8,000 out-of-pocket maximum, and he's already paid his $2,000 deductible, so he's only going to need to pay another $6,000 of that $20,000 bill to reach his $8,000 out-of-pocket maximum. And then his insurance is going to kick in and cover the rest of that bill. So I'm not suggesting that $8,000 isn't a lot of money, but it is better than the $20,000 that he would have had to pay if he didn't have that out-of-pocket maximum, or even the $102,000 bill that he would have had to pay if he didn't have health insurance at all. So again, that out-of-pocket maximum allows you to plan for a worst case scenario by knowing the most that you're going to pay out of pocket. And if you want to hear this information again, we do have this example in our animated video on health insurance basics. Now, the reality is, even having adequate health insurance isn't going to completely eliminate medical bills. And often people are left feeling like this guy chatting with his friend, saying that my doctor told me to avoid any unnecessary stress, so I didn't open his bill. Now, we don't recommend that avoidance coping strategy, but there are some key things to understand about how to manage your medical bills to reduce the financial burden. Even before you receive care, there are some things that you can do to lower the cost of your bills. As with many things that we talk about, communication is key, and you can ask your healthcare team about what your care will cost. I recognize that it can feel a little awkward to talk about money when discussing healthcare, but it is absolutely appropriate to know how much care is going to cost and if there are any programs to help you cope with that cost. Many hospitals have ability to pay programs and discounts or financial assistance. Some may even waive a portion of the bill. Another option is to ask your health insurance company if they have any case managers that can help you through the process. Now, I caution people to keep in mind that these case managers still work for the insurance company and not for you, but it can be really helpful to know that you are going to speak with the same human being every time that you call. You can negotiate with your providers before getting care. For example, hospitals have billing departments and even patient navigators that can help you with this. When it comes to getting lab work done, not all labs charge the same amount. So you can get a list of the tests that are going to be performed and shop around for the lowest price. And healthcarebluebook.com is a site where you can put in your zip code and it will give you a fair market value for the tests in your area. If you can, group your medical appointments together so that you are only paying for one copay for your office visit. This may not always be possible, but you never know until you ask. There may also be times when you can take a generic drug instead of a name brand drug, which may be less expensive, or even a less expensive course of treatment. But if you've never discussed finances with your healthcare team, they may just give you the option that they're used to giving. But of course, please make sure that you have adequately and thoroughly discussed the generic option with your doctor and that it is not a purely financial decision. We would never suggest taking a less effective course of treatment for financial reasons. So once you have received care, you are probably going to get a ton of correspondence. Just from the insurance company alone, you could get 3 different pieces of mail. One saying that we have received a claim, one saying that we are processing the claim, and one called an explanation or an EOB. So this is an illustration of the types of information that you might find on an EOB. And every insurance company presents this information in slightly different ways, but generally they should all have this minimum level of information. So you will be able to tell that this is not a bill and this is an EOB because somewhere on the form will appear the words, "This is not a bill." You'll be able to see some information about the policyholder and who the claim is for. You will also get some sort of summary of the claim. And then there should be some details about the actual services that are being billed. Many EOBs don't have words on them, and even the ones that do can still be challenging to decipher, which is why it's important to ask questions to your provider or the insurance company. A good EOB will also have some information about how much you've paid towards your annual deductible, or how much you've paid towards your out-of-pocket maximum, but not always. Then finally, the last piece of information that you're going to get is from your provider, and that's going to be the bill. The challenge in this system is that these pieces of communication don't always come in that order, which is why it's critical to keep track of the paperwork. Often, providers are a lot faster at sending the bill than the insurance company is at processing the claim. And if you pay a bill before you get to look at your EOB, you may end up in a situation where you are paying the provider more than what is actually owed. And then you're in a situation where you have to ask for money back from the provider, which is just one additional step. So waiting until you get the EOB before you pay the bill is a good course of action. But make sure you communicate that with your provider. So if you get the bill, the due date is coming up, you can give your provider a call and say, "Hey, I got your bill. I'm still waiting on the EOB. Can you push back the due date or make a note in my file?" So that they know that you still will be paying the bill once you get your EOB. And to date, we haven't heard any issues with this strategy. So once you get the bill and the EOB, check it for accuracy. We strongly recommend reviewing your medical bills. Medical billing is a human process and humans make mistakes. So it's just really valuable to make sure that you're actually being billed for the services that you received and to check for an incorrect number of something, like being billed for 11 surgeries instead of 1 because they accidentally hit the 1 twice. or being billed for things that may have been ordered, but then never happened. Let's say, for example, your doctor orders a specific type of blood test, and then they change their mind and you never receive that blood test. You shouldn't be billed for that. And if you have extensive bills, consider talking with a professional bill reviewer or medical claims organization.
So Madison mentioned earlier that understanding the terms that are used in a policy is a key step to being able to effectively navigate a health insurance policy. But it can be challenging to keep track of all of somebody's medical expenses, particularly if they're dealing with a serious medical diagnosis like cancer. And so Triage Cancer has created a brand new resource. You are the first group of people to learn about it. And this is our medical bills tracking worksheet. It is a Google Sheet or Excel document that you can download using this link, triagecancer.org/worksheet-bill tracker. And then you'll be able to download your own version of this worksheet. The first page is just an example. And then if you click on the sheet to the right at the bottom, it's actually an opportunity for you to include your personal information and track along the year as you are paying these expenses. If you rely solely on the insurance company and the EOBs, you may actually end up being in a situation where you've met your out-of-pocket maximum, but then the insurance company hasn't sent that EOB yet, and you're still paying things like co-payments out of pocket. And so tracking yourself, make sure that everything is up to date. But then you can see towards the right, there's also an opportunity to indicate if something may need to be appealed because it seems incorrect, or if you have a flexible spending account or health savings account, does that medical expense need to be submitted? Have you submitted it? What's the status at it? And so I know it's a little bit hard to see. So to get this bill tracking worksheet, you just go straight to our website at triagecancer.org/worksheet-bill tracker, and you can download it yourself. And this is just a blown up version to make it a little easier to see. But this is where you're going to put in your information. So you'll put in your plan name, you'll include the full amount of your deductible, and you'll include the full amount of your out-of-pocket maximum. Then as the year goes on and you add expenses to the bottom half of this spreadsheet, the spreadsheet is set up to automatically calculate how much you have left to pay towards your deductible and how much left you have to pay towards your out-of-pocket maximum. And so it's just another tool for you to be able to stay organized with what you are paying out and potentially if something needs to be appealed. What I mean by that is that there are many situations where during the course of cancer treatment, you may end up with a bill that the insurance company says they're not going to pay. In that case, we want to empower individuals to understand that they don't necessarily have to take no for an answer. Denials of coverage are very common. And unfortunately, not enough people understand the appeals process to deal with those denials. When I talk about the appeals process, it is challenging because it's one more thing to put on the plate of individuals who are already potentially overwhelmed. And so I'm going to set up this conversation acknowledging that inherently it is another thing to do. But when we are talking about how to avoid financial toxicity and deal with medical bills, it is important to understand the appeals process. So the very first step in the process is to figure out what type of health insurance plan you have. Depending on the type of plan that you have, whether it's Medicare or Medicaid or something from an employer plan or something you've purchased from the health insurance marketplace, the specific steps of appealing could be different. Now, we do have a module on cancerfinances.org that is specific to the appeals process and asks you questions to help you identify those specific steps for your type of plan, but I'm going to use individual plans as an example to talk about it today. So if somebody has a plan that they purchased directly from a health insurance company or from your state's health insurance marketplace, otherwise known as healthcare.gov or Obamacare, then you have, generally speaking, two levels of appeal. The first is an internal appeal, where you are going back to the insurance company and asking them to reconsider their position that they're not going to cover this. So every company has slightly different rules. It is very important in the internal appeals phase that you are following that company's specific rules. So if they say it has to be, submitted via certified mail, submit it via certified mail. There are also timing requirements that are important to understand. So if you are appealing a denial for something where you've already received that care, you actually have to do that within 180 days of getting that denial. And then the insurance company has to give you an answer within 60 days of getting the appeal. But sometimes we see situations where someone has gone to the insurance company and asked for prior authorization or pre-authorization for services. And if the insurance company says, no, we're not going to cover that at that stage, then if you appeal that decision, the insurance company has to give you an answer within 30 days. But the thing is, many times in the context of cancer care, when somebody needs to appeal before they've received care, they need an answer before 30 days. And so in those situations, when the delay in treatment would seriously jeopardize somebody's overall health or subject them to severe pain, they can actually ask for what's called an urgent or expedited appeal. And in that situation, the insurance company has to give you an answer within 72 hours. Now, if someone exhausts the internal appeal with the insurance company, they have an additional level of appeal called an external medical review or an independent medical review or an external appeal, all terms for exactly the same thing. But it is where you go to an independent medical review organization, an independent entity from the insurance company, and ask them to look at the facts. So look at the policy that you have, look at the service that you are asking for, and ask them to make a decision. The decision of the independent entity with an external appeal is binding on the insurance company. Now, when we talk about external appeals, there are also timing requirements. So if you've exhausted the internal appeal phase, you have 4 months to then file an external appeal. And the independent entity has 45 days to give you an answer to that external appeal. But remember how I said in the context of cancer, many times someone needs an answer faster than that? Well, in that case, you can actually file an expedited external appeal as well. And in that situation, you can actually file the urgent internal appeal at the same time as the urgent external appeal. And then you'll get the answer within 72 hours. There is another type of plan someone could potentially have through an employer called a self-funded plan, and the rules are slightly different. So there's still an opportunity to do an internal appeal and an external appeal. And in some situations, someone may even be able to sue in court to get limited financial recovery. So just like with the other types of insurance policies, there's timing requirements. And I know this is a lot of detail and a lot of information, but I just want to remind you that this information is all available on our website in a number of formats. regardless of the type of insurance policy that you have and the specific details around the process for filing an appeal, the one thing that is constant across all of the different types of insurance policies is step 2 and step 3 in the appeals process. So step 2 is understanding why the insurance company denied the service. So in the cancer context, many times the reason for denial is that the service is considered experimental or investigational. And that could potentially be a clinical trial participation. It could also be that someone's receiving what's called off-label drug. And so that's a situation when a drug is FDA approved for one type of cancer, but science is starting to show that it's really useful in another type of cancer. And so now you're using it, quote unquote, off-label. Insurance companies may deny you for that. They may also say that you're not eligible for the benefit requested under your plan. And so maybe you are getting a type of cancer screening that isn't typically necessary in your age group, but because of personal factors, your provider wants you to get that screening. So really understanding why the claim was denied is going to be pivotal to step 3, which is gathering your evidence. And the evidence that you need to gather is to show medical necessity. Medical necessity is, in fact, the legal standard for winning an appeal. And so how do you gather evidence of medical necessity? Well, certainly it could include letters of support from the prescribing physician. It could include any sort of testing. If the physician is prescribing something off-label because of a great study that just came out, including that study results in there. And certainly any other medical records that speak to the medical need or the medical necessity for receiving that service. Now, accessing medical records all by itself can be a hurdle to the appeals process, particularly if someone has received care in multiple facilities or across state lines. It can be a lot to gather your medical records. We have 2 resources I wanted to share. The first is our quick guide to accessing medical records, which talks about some of the more practical tips to gathering your medical records. And the second is a partnership we have with an organization called Citizen. And Citizen is a company that helps individuals with certain types of cancer listed here gather all of their medical records into one place. Electronic medical records into one location, and then creates a summary sheet. So it can be helpful for people, again, that have extensive medical records. Another hurdle to the appeals process is that you have to stay organized. And so many of these things around appeals, I feel like, are easier said than done when we're talking about someone who is also coping with a serious medical diagnosis and all the things that come with that. And so when we talk about staying organized, I generally say the Post-it note method of taking notes is not advisable, because you really want to keep track of all the conversations that you've had, the people you talk to, any documents that you need to send or that you are expecting to receive, due dates, any sort of follow-up that needs to occur. To help you in this process, Triage Cancer has a appeals tracking form. It's a document, again, that you can download for free from our website. And it's just one way to stay organized if you do have to file an appeal. I also think that this is a really good time to delegate to friends and family. So if you have friends that, say to you, I'm so sorry you're going through all of this, please let me know if there's anything I can do to help. Perhaps that thing that they can do to help is sit on the phone with you while you are talking with your insurance company and take notes, and maybe write up a follow-up summary at the end. Now, another hurdle in this process is something called peer review. So Peer review is a process during the internal appeals stage where an insurance company will have a healthcare provider talk to the prescribing provider. So the health insurance doctor is going to talk with your oncologist. They chat, and that helps the insurance company figure out if, why this particular service was prescribed. The challenge here, well, there's a couple, but the challenge here is that many times the things that are being appealed are actually very highly specialized medicine. And oftentimes the doctor at the insurance company is talking with someone who is an expert in that specialized area of medicine. And so the insurance company doctor could be a retired OBGYN and really isn't up on the latest in cancer care. So it can be helpful in those kinds of situations for your provider to ask to speak with another oncologist, for example. It's not always guaranteed that it's going to happen, but that can sometimes be very, very helpful. Now, the other challenge with this peer review process is that people are sometimes confused and think that this peer review process is the same thing as an internal appeal. Even if somebody has filed an internal appeal and has had this peer review, they still have the right to an external appeal. So please remember that this peer review is not the same thing as an external appeal. And then finally, the last challenge that we see with the appeals process is really around knowledge. So many consumers receive denials of claims from their insurance company and don't end up appealing. And so this is just one study that was recently done around marketplace denials. And this study from the Kaiser Family Foundation found that of all the claims that were denied, less than 0.2% were ever appealed. So of all the claims that were denied, 99.8% of them were never appealed. This is particularly concerning to us as advocates because we also know that somewhere between 40 and 60% of all claims that are appealed are decided in favor of the patient. So when we think about that, between 40 and 60%, so roughly half the time when something is appealed, it's decided in favor of the patient. But 99.8% of those denials aren't getting appealed. So when we stop and talk about financial toxicity, certainly having the right health insurance, certainly navigating the policy to its full effectiveness is important, but also appealing these denied claims is an incredibly important step of the process, which is why at Triage Cancer, we have so many different resources dedicated to this subject, some of which I have already talked about today.
We do have a partnership with a medical bill management company called CoPatient, and they do professional bills reviewing. They can help with the appeals process and the negotiation of payment plans. And through this partnership that we have with them, you can sign up for their services for free for a year. But you do have to sign up through the exact link that you see on that screen. And you can also find more information about that partnership on that link as well. So throughout this whole process, people need to stay organized. And again, that's one of those things where it's very much easier said than done. This is not a great organizational system. But the key is that you pick an organizational system that makes sense to you, like file folders, 3-ring binders, electronic files. There's even some pre-built planners. There are also some electronic services. that you can pay for to store this information. It doesn't matter what system you use, as long as you pick a system and stick to it. The amount of paperwork can be overwhelming, but there are some strategies for this that can be helpful. And we have some excellent recorded webinars from a professional organizer that may be useful. So one of the reasons why we think people need to keep records of all this information is certainly for the appeals process. You'll need to keep them if you're submitting bills to HSAs or FSAs, but it can also be really helpful because some of these expenses can be deductible, which could increase your refund taxes, but you do have to keep records for that. If somebody is in a situation where they owe their providers, it is important to have a conversation and to negotiate with those providers. But that conversation has to happen before the unpaid bills are sent to collection agencies. Once you're assigned to collection agencies, it becomes much more challenging for the provider to do anything. There's a couple of different things that you could try, like asking for more time, writing off a portion of the bill, seeing if they'd accept a lower lump sum payment. And this also works with all other types of creditors like landlords, credit card companies, or student loan companies. And we do have some late breaking news in regards to medical debt and medical bills. So Equifax, Experian, and TransUnion recently announced changes to the way that they report medical debt to collection agencies on credit reports, meaning that people won't see that big hit on their credit report solely due to medical debt. But there are still some consequences if you don't pay your bills and you haven't set up any payment plans. So you may not be able to continue to receive care from that doctor or that hospital. You could have your wages garnished, and that means that they could take money directly from your paycheck. And if you stop paying on a debt that is secured by an item, like a car or a home, you do risk having that item taken away. And then finally, you may have to declare bankruptcy so that your debtors can get what is owed to them.
So a key piece of navigating medical bills is understanding what your plan does and doesn't cover, and making sure that you have the right plan for you. So we have many different options in this country for health insurance, thanks to the Affordable Care Act now. But how do we actually make choices? I'm going to give you an example using the marketplace or Obamacare. But this analysis that I'm about to do for you works whether or not you're trying to compare to marketplace plans, whether you're trying to compare to employer plans, whether you're trying to decide, well, do I take my employer plan or do I buy a plan in the marketplace? Or even if you're trying to compare between two different Medicare Advantage plans. This is the same exercise that you're going to have to do. So here are three different plans. You have a bronze plan with a $200 a month premium, a $6,000 deductible, and an $8,000 out-of-pocket maximum. You have a silver plan with a $275 monthly premium, a $2,500 deductible, and a $6,000 out-of-pocket maximum. And then a platinum plan at a $400 a month premium, a $0 deductible, and a $2,000 out-of-pocket maximum. So given that I have these three options, how do I figure out which plan is actually going to cost me the least at the end of the year, assuming that I'm going to hit my out-of-pocket maximum, which is a relatively safe assumption when we're talking about cancer care. So in that situation, we would actually have to do the math. We cannot tell just by looking at these numbers in this way. And the way that you do the math is you take your monthly premium and multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you add the out-of-pocket maximum. And when you do that for all three of these options, we see that the platinum plan with the expensive $400 a month premium ends up being pretty significantly cheaper by the end of the year. Now, it is important to note that the devil is in the details here. So this typically only works if we're talking about seeing in-network providers. If you want to go to out-of-network providers, the math is going to look a little bit different. And depending on where you get your health insurance, the math problem could be slightly different. And I'm going to walk you through another example of that in just a minute. But this is a really key step for everybody to be taking, even if they don't have a cancer diagnosis and may not hit that out-of-pocket maximum. Because without doing this math, there's no way to make an informed decision or to plan around a worst case scenario. But that end of year cost is just one piece of the puzzle. It is also helpful to look at the deductibles, what's included in the out-of-pocket maximums. Certainly, you need to look at if the plan you want to choose covers your providers and facilities. So that includes hospitals and labs and imaging centers. And you also need to make sure that any prescription drugs that you are currently taking and that you anticipate taking for the year ahead are going to be covered. There's a lot of information gathering that is necessary in order to make an informed decision around your health insurance options. Now, when you can enroll in insurance is going to depend on the source of your coverage. So if you get your insurance through an employer, typically they have an annual renewal period. It will vary depending on the plan, but typically they are in the fall to coincide with a calendar year start date. Medicaid applications are accepted year-round. As soon as somebody becomes eligible for Medicaid in their state, they can apply. Medicare actually has many different enrollment periods, but every single year between October 15th and December 7th, they have what's called open enrollment. And this is where you can change your Medicare options each year. The marketplaces also have an annual open enrollment period. Now, we don't have the exact dates for 2023 yet, but we anticipate that they will be around November 1st of 2022 through likely January 15th of 2023. If you live in one of the states that has a federally run marketplace, there are a handful of states that run their own marketplaces and their open enrollment might be slightly different. The specific details for each state is available on our charts of state laws at triagecancer.org. Now, Medicare plans and marketplace plans are calendar year plans, which means that even if you pick a plan on day one of open enrollment, the earliest that that plan is going to start is January 1st of the following year. Now, the good news is that there isn't just open enrollment. When somebody experiences a life change or a loss in coverage, like moving states or leaving their job, there are also special enrollment period opportunities to access these various options. And of course, more details are available on our website, and we will talk extensively about that in upcoming Triage Cancer webinars. But the reason I wanted to talk about open enrollment is because many people don't realize that picking a health insurance plan is not a one-time activity. It is actually something we need to do every single year. It may be that you look at your current plan and you think, yep, it's still meeting my needs. And that's fine. But we need to look at it every single year because what's available could change and your needs could change. And so looking at your options every single year, or when you are experiencing a life-changing event like changing jobs or moving, is going to also be valuable. And it's not just about health insurance, particularly if you're changing jobs. You're going to want to look at what other benefits that employer may provide that can impact your finances. And we have 2 checklists listed here that could be helpful in that situation.